The early 2000s was a landmark era in medical indemnity, with issues such as the costs of cover, some major medical indemnity cases, and some high-profile insurance company failures. As a response to this, the concept of open disclosure is now widely accepted in Australian hospitals and by healthcare professionals. The catalyst for a complaint or claim has often been failure to promptly and honestly advise patients of an adverse clinical outcome, an explanation for what occurred, and a patient management plan to move forward. The patient's perception, real or otherwise, that they've been deserted after an adverse event is a major contributor to legal intent. MIPS medico-legal advisor Dr Rob Walters has some further details about open disclosure and how it can assist you and your employer in managing an adverse clinical outcome with your patient.
Rob, there's this term called open disclosure that's being used more commonly these days. Could you tell us exactly what is open disclosure?
Michael, open disclosure is the discussion of incidents that result in harm to a patient whilst they're receiving health care. It's actually becoming part of contemporary medical practice. And you know what? It actually results in an improvement in the healthcare system in general.
But it hasn't always been like that though, has it, Rob?
No, it certainly hasn't. No longer can we say, don't worry your pretty little head, or trust me, I'm a doctor. That's all unacceptable these days. It's out the window.
What are the 8 key principles of the open disclosure statement?
Okay, well, the first principle is openness and timeliness of communication. Secondly, acknowledgement. Third, expression of regret, and make it as early as possible. Next, recognition of reasonable expectations of the patient and their support person. Fifth, staff support throughout this open disclosure process. Integrated risk management and systems improvement, good governance, and finally, confidentiality. Now clearly some of these principles apply to hospitals or institutions. So what I suggest you do is read and digest and take out what's relevant to your particular type of practice.
The old blame and shame principles seem to be thrown out the window. How do we actually implement open disclosure?
Well, look, what we've got to do first is identify that harm has actually occurred. And ensure, obviously, that no further harm does occur. This is a good time to notify and discuss the incident with your medical indemnifier. Also determine the level of response that's required, and that will be according to the seriousness and prognosis of the incident. Be well researched about the facts, reasons for the adverse outcome and their possible results, and then develop and explain to the patient a treatment and management plan.
What are some of the other important things that we need to remember?
Look, this can be pretty emotional stuff, not only for the patient, but also for the doctor. And don't forget, you might be confronted with a fairly angry patient, and so it's going to be a real test of your communication skills. So don't forget to listen, be empathetic, express regret, and nothing wrong with these days saying you're sorry that this has happened. Give a factual explanation of what has happened, and detail the steps you intend to undertake to manage the event. Also detail how a recurrence might be prevented.
You must notify MIPS Insurance in writing at the time you first become aware of any incident that may give rise to a claim against you. Failure to notify within the required timeframe may prejudice your right to receive a benefit under the policy. Insurers insist on strict policy conditions because of the need to assess for potential exposure, should it be estimated, should it be investigated further whilst contemporaneous. Open disclosure principles make the reporting of incidents even more critical. For example, it may involve other insurers and healthcare professionals and/or conflicting evidence. Early advice is essential. More assistance with the process will be available. For example, identifying that open disclosure is appropriate and ready to be actioned, provide support with an appropriate expression of regret, and the content to be discussed. MIPS, as your medical indemnity insurer, supports the concept of open disclosure. Promptly deal with patient harm. And contact MIPS for guidance. Do not delay and mull over issues such as liability and insurance.
Could you summarise the key messages for our participants in this module?
Open disclosure is important because, one, it assists us to care for patients when an adverse outcome occurs, but it actually improves the healthcare system generally as well. It helps prevent recurrences and, most importantly, it minimises the chances of unnecessary, traumatic and expensive litigation. There is no doubt that adverse outcomes will occur throughout your medical career, and I hope that what we've been discussing will help you prepare for that event.
For medico-legal advice, call 1800 021 223.